consolidate our efforts towards achieving the elimination of vertical transmission of HIV and syphilis. And this is one of the key steps that our region will take towards the goal of 90-90-90 and towards the goal of elimination of HIV transmission and syphilis transmission to babies. So we are the first to have set this target. We do know that there are other countries in the world, some 30 countries, who are themselves ready to ask for validation. I think that we are at a point where we have shown that we are turning the corner. And we have done that because of the commitment of many governments, of many heads of state, of ministries of health, of healthcare workers, ably supported by many organizations like PAHO, like UNAIDS, like UNICEF, like PEPFAR, like Global Fund. We have come together and supported countries to ensure that they can meet these targets and that we can set a stage for 000, which is the UNAIDS goal. And so together we congratulate Cuba, and we are hopeful that this region can move to the position that Cuba is in very shortly. Thank you.
Thank you, Dr. Etienne. Me gustaría ahora darle la
Now I'd like to give the floor to the Minister of Public Health of Cuba, Dr. Roberto Morales Ojeda. Thank you very much. Distinguished Dr. Carissa Etienne, Director of the Pan American Health Organization, distinguished guests, I would like to first start by expressing thanks to PAHO and its Madam Director for this gracious invitation to take part in this act. It's an honor for us to represent our authorities and our people, especially the Cuban health workers. Today, the result of a process that we started a few years back in response to a commitment that we took on at the 50th World Health Organization in 2010 goes public. So when the countries of the Americas approved the strategy and the plan of action for the elimination of the mother-to-child transmission of HIV and congenital syphilis, the problems of which are well known by all. Now, the triumph of the revolution of the 50s and the 60s led to the creation of a healthcare system that offers 100% health coverage to the Cuban people. It's free and region-wide. It's comprehensive and within reach of all citizens in the countryside and the cities alike, without any type of discrimination, with community participation as well as cross-sectoral participation based on primary health care, with the family doctor and nurse program, with an international approach as well. Now, throughout the development of our healthcare system, epidemiology has played a key role. It is the tool for us to better understand the behavior of different health problems, which beset the population that so that we can tackle them appropriately. The first efforts put forward by Cuba to tackle congenital syphilis started in 1970. In the 70s, during the same decade, we kicked off the program to eliminate mother-to-child transmission, which was part of the overall program to eliminate congenital syphilis. Now, among the achievements, 90.9% of childbirths, of deliveries take place in healthcare centers. The death rate is 4.1 for every 1,000 live births. And maternal mortality is 35.1% for every 1,000. From 1980 on, the annual congenital syphilis rate has been kept under the criterion of elimination set by the regional strategy. Over the last 4 years, it has gone between 0 and 0.04 for 1,000 live births. I should point out that the aforementioned program was brought into the overall healthcare system, placing priority on the use of nurses to avoid sexually transmitted diseases and primary health care to ensure thereby universal coverage and access, which has made it possible for us to sustain these achievements. With the beginning of the HIV epidemic in 1986, and knowing that one of the risks of transmission was precisely mother to child, the very first control and prevention program included tackling this type of transmission. Different programs that were developed throughout the world coincide with this. Now, in this fight against HIV, our approach is preventive, and it entails intersectoral community involvement. And so I can say about that in Cuba, the prevalence of HIV is from the 15 to 49 years of age is 0.25%. Those living with HIV that have been brought under the healthcare system that has trained HR as well as antiretroviral medicines and laboratory services, as well as an information system that offers national coverage for monitoring the problem. The mother-to-child transmission is under 2% over the last 3 years. At the same time, countries of the region have also shown their headway made in their effort to achieve the elimination of mother-to-child transmission of HIV and congenital syphilis. Some of them show figures comparable to the goal that was set or are close to reaching that goal. In our case, everything we've achieved in this and other areas of healthcare have been possible, first and foremost, given our social system and given that there has been a political will from the highest levels down to ensure that a country that has scant financial resources has been able to provide for 57 years health care for all. And the results of this is a result of the work and the commitment of more than 500,000 healthcare workers, civil society, and the community of those who live with HIV, as well as other sectors, all pulling together. Madam Director and distinguished guests, we thank you for the trust that this Pan American Health Organization has placed in us in offering its technical follow-up in this process that we're including here. Any recommendation was given the highest level of priority to ensure its sustainability and to ensure the best results. We feel recognized and acknowledged in the fact that we are the first country to have the elimination of mother-to-child transmission of HIV and congenital syphilis. We're proud of this, and we are happy to share what we've learned with other countries of the region in the hopes that they too will achieve the same results to the benefit of the people of the region.
Muchas gracias.
Thank you very much, Mr. Minister.
I'd like to introduce Luis Loures, Deputy Executive Director of UNAIDS and Assistant Secretary General of the United Nations. Dr. Loures.
Thanks very much. I'll speak in English. It's a pleasure to be here. I'm back home, with Carice allows me to say. It's really a special honor to be here, Minister, with you and with Cuba. You know, this event for us is the beginning of the end of the AIDS epidemic. That, I think, it's the best way to describe your achievement and what Cuba has done. It's making clear that it's possible, that we can take this epidemic down. More than ever, we are starting to make it a reality with the achievement in Cuba. At this moment, as I speak to you here, UNAIDS is meeting in Geneva. We have our board meeting going on. And there are 400 people in the room today in WHO at this time celebrating our achievement as you speak, under the leadership of Michel CDB, that's leading the board. And I think it's to be so. We are proudly speaking about your achievement to 22 member states, NGOs, and a big representation of the United Nations at this moment in Geneva. We are just waiting for the embargo to be break to have the discussion start in Geneva as well. My more than achievement in Cuba, Minister, I think your achievement is inspiring all of us at the global level and particularly the global plan. There is a global plan going on to eliminate mosquito-child transmission. Things are going well, no question. We have half of the number of infections happening the last year compared to 2009, when we still saw almost 500,000 infections among children. Today, it's close to 200,000. But there is no reason for us not to go there, not to really to go to zero, as Dr. Carissa highlighted. But again, is your inspiration that's going to bridge what is happening in the global plan, but actually to make the global plan reality for the rest of the world, as for Cuba today. We expect more from Cuba. In 2003, I had the privilege, the honor, of meeting President Fidel Castro to talk about the AIDS epidemic. It was a long discussion. On that discussion, the main focus was what you said, the Concepción Internacionalista de Cuba. We are already talking about how could you build on the Cuba experience to fast-track the response to AIDS, to bring us to 2014. Last year, I was in Sierra Leone. I am part of the strategy group of WHO on Ebola with Dr. Champ, and I was in Sierra Leone when I had the pleasure to meet before anybody the Cuba delegation that was already going to the field and showing to us how to accelerate the response to AIDS. Again, the Concepción Internacionalista spoke to your president in 2003, and I saw that happen as far as last year in Sierra Leone. We need that now back more than ever. Your experience should be now shared with the rest of the world. The concept, the factors, as Carissa highlighted, and you, other countries need also to mirror to fast-track their own response. UNAIDS, we are prepared, together with Carissa, with WHO, to support Cuba in share your experience with other countries and other continents in the world. This is particularly important now. We are entering the SDG era. We are redefining the global agenda in all aspects, including on health, what will be the post-15 agenda. But I have no doubt that the post-15 agenda will depend fundamentally for us to doing better than you are doing today. And that goes through the partnerships, that goes through much stronger South-South cooperation. That, Minister, goes through the post-15, grows to a Concepción Internacionalista. And that's what will help, what we count with Cuba to help us to move to end the AIDS, but more than that, for a better world in the near future. Thank you very much, and thank you all for inviting UNH to be here, in particular Carissa, our friend.
Thank you, Mr. Lourdes. Thank you. Finally, I would like to introduce Adele Ben-Saken. She's the co-president of the Regional Validation Committee, and she will briefly explain us the process followed to give this validation. Dr. Ben-Saken, please.
Muchas gracias. Buenos días.
Thank you very much. Good morning. I will be speaking Spanish in honor of our guest, Minister of Health from Cuba, Dr. Roberto Morales Ojeda. And I would also like to greet all of the healthcare workers in Cuba who gave us such a gracious welcome in the validation process, through which you have overcome that barrier, and this was quite an achievement for them. I would like to greet Dr. Clarissa Etienne, Director of PAHO. This is an organization that I am very proud to have been able to give advice to over so many years, and the assistant director, my Brazilian colleague from UNAIDS, Dr. Luis Lourdes, who I would also like to greet. And so, good morning, everyone. I was asked to talk a little bit about the validation process of Cuba. In May of 2014, the Regional Validation Committee was created for the elimination of mother-to-child transmission of syphilis and HIV. It bears mentioning that PAHO, from the outset, put these two ailments together, congenital syphilis and HIV. This had the support of PAHO, and there was a group of 14 independent experts put together, brought from different regions or areas of the Americas region. And the purpose of this committee was to assess whether the candidate countries could be recommended for global validation or for the countries under evaluation to make recommendations by way of overcoming gaps toward the elimination. Following what UNAIDS calls for, that is, to not leave any country behind, leave no country behind. So the first undertaking was to finalize the host of tools necessary for the validation process itself. These tools were in line with the global committee of validation of WHO. 4 tools. 1, national programs and services with data of management and providers and different healthcare providers, with interviews and observations carried out on site, an evaluation of the laboratory, starting with the National Reference Laboratory to the sub-national and local level laboratories. 3, the human rights aspect, gender equality, as well as the participation of the community, which included civil society organizations. And the 4th instrument or tool was the data verification aspect and gauging the impact based on epidemiological and strategic information from the country. In December of 2014, there was a pre-validation visit carried out in Cuba by a 4-person team, 2 members of the Regional Validation Committee and 2 from Cuba's Secretariat. The purpose of this pre-validation visit was to review together the report that had been sent by Cuba to PAHO so that we could familiarize ourselves with the context of the country, but first and foremost to prepare to do the groundwork for the visit of the validation committee. That visit was carried out March 21st to 27th of this year by a group of 28 experts, 10 from the Regional Validation Committee. That broke into 4 different groups, 2 in Havana, where we have the largest number of cases and services, another in Santiago de Cuba, which was the second, the city with the second largest number of cases in the provincial areas outside of Havana, and Villa Clara, which is a region that has a lower level of performance in some of the algorithms than in the other regions we visited. That means that 3 different regions of the country were represented. The places visited were the polyclinical maternal wards, family health centers, labs, municipal organizations for surveillance, epidemiological surveillance programs, stats, and other programs at the local level. The comprehensive healthcare centers, civil society meetings, as well as representatives of people living with HIV/AIDS. Now, the results of this week-long visit showed that Cuba makes services available. They are widely accessible. I think we should stress here the example set by Cuba in how it has organized its services, especially starting with the primary health care, its sustainability. Cuba has a large number of healthcare workers, as the minister himself just said. The human rights aspect. There is broad community participation and the ongoing work carried out by these comprehensive healthcare centers, as well as the laboratories, which provide diagnoses and treatment for patients. And ultimately, the issue of data verification and measuring the impact is one of the main strengths that Cuba has, as it holds up as an example for the world. Now, the report of the committee essentially said that Cuba met all of the requirements to be the first country in the world to have achieved the elimination of vertical transmission of syphilis and HIV. This report was sent to the Global Committee, which just last week approved it, and that's why we are here to announce that decision. Thank you very much.
Muchas gracias, Adel.
Thank you.
Much. Now, also a key partner in this achievement, now I would like to introduce Mikey Chopra, Chief of Health and Associate Director of Programs of UNICEF. Dr. Chopra.
Thank you, and I have to speak in English, I'm afraid. We are pleased to be here and reflect on the success that shows what can be achieved when you get to a universal health coverage, when you take into account equity and reaching every woman, every child. And we're very pleased to be here with the PAHO and UNAIDS and other partners to support this excellent effort. It also shows that it is possible to achieve such a thing as the virtual elimination of mother-to-child transmission as well as syphilis, that other countries in this region are on the verge, and this example will surely show that we have the technology, we have the tools, we have the know-how of how to do it. It's a matter of now doing it. I think it also behoves us to reflect on the continuing challenges of those children who unfortunately have been infected. We still lag behind in terms of treatment for HIV-positive children compared to adults. Only globally 1 in 4 children who require antiretroviral treatments receive this treatment. So the challenge is not just one of prevention, it's also one of the rights of children who are infected to get the best treatment. And we have now also from around the world, and in this region in particular, examples of when children do get treatment, they can become and do become productive and very full members of society and contribute immensely to the economic well-being. And perhaps that's my last message, is that the investment in universal health coverage, in quality of care, is not just an investment in people, but it's an investment in the country. The cost savings that will be, that are already reaping the benefits for Cuba and for many other countries will pay back the investments that they've made in establishing the infrastructure of primary care, of reaching every woman, every child. So not only is achieving this goal a momentous achievement for the women and children of Cuba, but also inspiring for others across the region, but it also shows that the investments made in health and in primary health care and universal health coverage will reap massive economic benefits moving forward as well. So, Madam Chair, thank you very much.
Thank you very much. Thanks for those remarks. Now we will take questions, first from the floor and then from live stream and social media or email. Remember that you can ask your questions in Spanish or in English, as we have simultaneous translation. So, and you can also send your questions through email to mediateam@pajo.org. We are receiving already a lot of questions for what I'm seeing, but I would like to offer the floor first. AP, Luis Alonso.
Hola, buenos días. Soy Luis Alonso.
Good morning. Just a clarification. It says that there are 6 countries and territories of the Americas that are capable of requesting this validation. I don't really understand why Cuba achieved it and the others haven't. Does each country have to make their own request individually? I don't really understand why Cuba got it and other countries meet the requirements, they haven't yet achieved it. The committee has also engaged in other validation exercises in other countries. at request, went to Guatemala, El Salvador, Chile, to make the initial contact. But the country that wants to have the validation done has to submit first a report and has to send in an application to PAHO to start the process. And so Cuba was the first country to make that formal request of PAHO, and the first country to follow through all of the steps, first the evaluation of the report and then the visits. The Madam Director said there are some other countries who have announced that they have made the request. Massimo Girinelli, Unit Chief, HIV, Hepatitis, Tuberculosis of STI in PAHO. Yes, there are 4 other countries, as you mentioned, that have already initiated this validation process by sending a letter to the Madam Director of PAHO, that is from the Health Ministry, and we have a work agenda so that we can follow through with those cases. Anguilla, Barbados, Jamaica, and the British Virgin Islands. Dr. Etienne.
Nombre y medio, por favor.
Name and media, please. Thank you very much. Waldo from the Prensa Latina. My question is, if there is an idea, is there any plan to try to replicate Cuba's plan in other countries of the region? I'd also like to ask Dr. Etienne, in this new context, in the renewed relations between Cuba and the United States starting in December, what is this going to translate into as far as the health throughout the region and this groundbreaking news?
So, it is true to say that all of the countries of the Americas have embarked on a single program that they have specified to their particular situation. So PAHO, with the other organizations, we have worked around a plan of action, which is the same plan of action that Cuba deployed for making this achievement. In 2010, all of the countries of this region, including Cuba, including United States of America, they came to an agreement that they would work towards the elimination of HIV, transmission of HIV and syphilis to children by the year 2020. And so it's part of a process. I figure that the new political climate between the United States of America and Cuba can only help the achievement of this goal. But certainly Cuba has also been working with other member states, not only towards this goal, but also to increasing the access to healthcare services through the Cuban Doctor Program. Thank you.
Okay. Tenemos otra pregunta.
Is there any other question? I'm from El País, from Spain. I have 2 questions. Without minimizing the achievement of Cuba, the other countries who are in the process of validation are close to doing so. These are relatively small territories or countries. And so my question is, there are other countries in the region, the United States and Brazil, which are much larger, given their size and infrastructure and so forth. Is size taken into account in the validation process, or are the parameters exactly the same for all countries, regardless of advantages or disadvantages the country may have? That's a technical question. For Mr. Ojeda, I would like to ask you if you have received any request from any country that's interested in learning from your experience, sharing with you what your process has been in this validation process. Thank you.
Dr. Lourdes.
Dr. Lourdes.
Doctora Carissa.
From a global perspective, not just in the region, but globally, because Dr. Etienne already spoke about the countries of this region, but the health minister, Dr. Morales, has come here to talk about a very important experience underway in Africa at the end of this year, continent-wide. Cuba is sharing with Africa its experience. Now, your question regarding the different countries involved and how they are different, yes, certainly. The larger the country, the larger the population, certainly that entails more difficulties. Not all countries are just like Cuba. Cuba has a long-standing healthcare excellence, but in South Africa, for example, is a country hardest hit by AIDS today that has achieved a considerable reduction in the infection level among children. So, yes, this is possible. Now, developed countries, you've got the Russian Federation that has also done quite well, that has very low levels, so they're close to the elimination of vertical transmission. And there are other examples. I'm hopeful. I don't think that Cuba is the only country that can achieve this, or a handful of other countries. Without a doubt, the Cuban experience can be adopted by all countries. The combination of a working healthcare system, of mobilizing people, and the most important thing, which is the political will and decision to make it work, that can work in any country.
So there are a number of countries across the world who are requesting validation from WHO. So we have some of the countries of the Russian Turkmenistan, Bulgaria, Belarus, Uzbekistan, Moldova. We have also countries like Cambodia, Malaysia, Thailand, and Sri Lanka. And in the Eastern Mediterranean region, we have Oman. We are working with the larger populations in our region to advance towards elimination as well. We believe that both in United States of the Americas and Canada, that they have reached the goal for elimination. However, they've not requested validation. And we are continuing the work with the larger populations who are themselves. There has been a marked reduction in the number of children born with HIV and syphilis across the region. And this is so even in some of our countries with the larger populations.
Doctora Bensángel. Ah, no. Perdón, sí.
Bueno,
regarding the question that was asked, certainly there are other countries that have made their request, or asked us rather, to share experience with them. But as far as collaboration goes, Cuba does have health professionals in 78 countries, more than 50,000 healthcare professionals operating in these countries, more than 25,000 doctors out of that group. So one of the main elements in order to achieve any result, as Dr. Carissa Atin was saying, is affordability and universal access and coverage in health. So these countries in which there is a higher rate of syphilis and HIV and vertical transmission, especially in the African continent, where there are more than 4,000, where we have more than 4,000 collaborators in 20-some countries, certainly we are having a positive impact. This is an essential element for us to help these countries achieve this purpose, because the plan that was launched by WHO in Cuba became a plan of action in our country, approved in the 50th Executive Council. And so, yes, with that universal health coverage, with communities' participation, and with a cross-cutting approach with the involvement and participation of all the players involved, bringing to bear all the different sectors, yes, it can be done.
Creo que
I think to answer the question, certainly It's much more difficult for a continent-sized country such as Brazil to carry this out when you have much inequality within a given country. It's harder for that country to achieve a validation, but validation is done country by country. There's no exception to that. There are other initiatives. For example, last year, the mayor of a city in Brazil, the city of Curitiba, signed with UNAIDS an agreement for the elimination of HIV by 2030. So Curitiba is a city that has a near elimination level rates. Now, there are other initiatives that countries might rally around and be in agreement to, but it is more difficult in some cases. Certainly, I would like to also stress that large countries can use different tools for a quick diagnosis of HIV and syphilis, and who can grant access to people who live in remote far-flung areas. To the extent they could do that, well, that certainly can go a long way toward eliminating the mother-to-child transmission.
Ok, muchas gracias.
Thank you. If there aren't any further questions, then let's look at the questions that have come in through live stream. And we've got Ramon. What are the outstanding elements in the Cuban system that made it possible to achieve this elimination? Minister. Well, we can start by saying the political will, which translated into a host of measures that the authorities issued. So you had the authorities on board, you had the participation of our people, and a healthcare system which is free and universal and regionalized and accessible, whose main strength is primary healthcare, with the family doctor nurse program, which starts from a preventive standpoint to following through the postpartum, in which mothers and children aren't the only ones included in this very important program that we've been working on to eliminate vertical transmission of HIV and syphilis. But also, you see this in the indicators of preschool or child mortality, preschool child mortality, and mother mortality. Thank you, Minister. Coming from a country such as Brazil, when the HIV epidemic started, a vertical system was created and special services were established. I think the opposite happened in Cuba. And Cuba has given us example that if you strengthen first the primary healthcare system, the primary healthcare system is the entry point of any type of malady. So that team, the primary health care team, is monitoring an ongoing business. You don't have to set up a specialized parallel system. This, as we see it, is what we've been trying to do for the last 30 years in Brazil. That is to focus, to manage HIV epidemic from the primary health care approach, as Cuba has done. And that's what what made it possible for Cuba to achieve the elimination. I would just add to that, that when we talk about universal health coverage, we're also talking about access to medicines and technology. Now, we can talk about the different results and what was it that made it possible for us to hold up this example to the world. And that is that we have the development of a pharmaceutical and technological industry that has made it possible for patients to have access to antiretrovirals and to ensure that they have everything they need and free of charge. I think this is something that, well, taken together with our technicians who can diagnose the problem, that closes the circle of all the different elements taken into account in developing this program. Dr. Chien.
Thank you. It is probably not well known in this region, but in 2008 at WHO, at the time I was the Assistant Director General, and we led a program called Positive Synergies, which was a study that demonstrated that many of those vertical programs were inadvertently weakening the health systems. And I think Ebola has shown us that if you have a resilient health system that is based on primary health care with universal access, that you can confront any of those challenges, be it a natural disaster, be it emerging infectious diseases or re-emerging infectious diseases. At that time, it was a battle because people thought that it was only through those vertical programs that you could advance treatment and management of conditions like HIV. And so this re-emphasizes the need to ensure strong health systems that are based on primary health care with universal access to health and universal health coverage. This is the best way, the most sustainable manner of any country ensuring the health and well-being of its peoples.
Thank you, Dr. Etienne. Another question from John Cohen from Science. How can you compare Cuba, an island with limited spread of HIV, with larger countries that have more infected women? Any take?
No, I think I would say that yes, it's probably was easier for Cuba, which is a small population, which is a contained population, but it is a country where universal access to health and universal health coverage has a very long history. But we are demonstrating as well that in countries like Brazil, in countries like Chile, in countries like Costa Rica, even Guyana, that we have been able to reduce the level of transmission to below 5%. So it is possible not only in Cuba, it may well be that the advances that countries like Brazil and countries like Costa Rica and Chile have made as far as universal health coverage is concerned and universal access to health puts them in a better position to ensure also the result of elimination of mother-to-child transmission of HIV and syphilis. Thank you.
Thank you, Dr. Lourdes.
Thanks. Hi, John. Among the 22 countries globally today, most in Africa, that account for 90% of the new HIV infections, we are seeing a reduction of more than 50% on the rate of infections from 2009 in 12. It's possible. I think this is the best evidence that, of course, there are particularities in different countries, but it's possible everywhere. There is no question. There is, if you see globally, there is a concentration of countries that are probably closer to elimination in the Americas. Maybe Parrot is doing better than other regions, and that also we need to analyze. Could be, I think there is more incentive, more pushing to go for the elimination. But again, I think the factors that influenced for the outcome that we are celebrating today in Cuba, they can be applied in countries regardless of the challenges that we are seeing today. Political decision, stronger health systems, and fundamentally, empower of women, the position of the women in society, can be changed everywhere and needs to be changed for us to go to the end of AIDS and to eliminate mother-to-child transmission. There is no, I think there is not a contradiction here. It's not a case specific to Cuba. What is specific to Cuba, but is the case of the other countries to learning from, is what made it possible to eliminate. It's not geography. It's how Cuba is doing.
Yes.
Yeah, just
Michael
want to.
Chopra from UNICEF.
just build on Dr. Lores's point previously as well. The country with the largest HIV population is South Africa by far. 75% of all antiretrovirals in the world are consumed in South Africa. And it's been notorious in previous times for its slow progress. But actually in the last 5 years, the recent evidence is showing that transmission is gone below 5% from mother to children in South Africa. And once again, a key feature there that changed the landscape was the empowerment through civil society, through grassroots activism of women, of communities to demand the treatment and to demand the preventive services. So it really emphasizes that this is not just about the primary healthcare systems, which is fundamental, and political leadership, which is critical, but also about the community empowerment and the grassroots activism, which is where success is really sustained.
Thank you. I'm going to give you like the last 3 questions we have here so we can wrap up. The first one, la primera va
For Dr. Morales Ojeda, the Minister of Public Health of Cuba, you cited a number of variables that made it possible to achieve this. What about scientific investigation and research in the production, well, in theory, as well as the dissemination of effective strategies? And what research is underway that might give rise to the internationalization of the Cuban model? The Cuban health system has had an essential element of ongoing research in the field of services as well as the pharmaceutical industry, all of which have made it possible for us to create a model that's a work in progress, always being perfected. And this can be seen in the results that we have achieved. And when I talked about having a group or host of products that we produced as a result of this research, this is a closed cycle of research, development, and commercialization of our products so that Cuba can tackle the HIV epidemic, which goes back to 1988 when the first case was found in our country, and the program to tackle syphilis, mother-child transmission, was in 1970. And so we're talking about a period of time in which research has played a decisive role in this ongoing process of perfecting our system based on the results we've achieved. Again, the actual perfecting of the Cuban healthcare system being part and parcel of that. What are the indicators to validate Cuba as a country that has eliminated mother-to-child transmission of HIV and syphilis? This does not apply only to Cuba. The indicators were proposed by PAHO, which was the rate of congenital syphilis, which had to be under or equal 0.5 per 1,000 live births. And Cuba, over the last couple of years, had an average of 0.02 cases of congenital syphilis for every 1,000 births. The rate for HIV had to be under 2%, and Cuba, over the last 3 years, had a 0.02% rate. We also looked at the treatment coverage, antiretroviral treatment for pregnant women. We also looked at treatment for syphilis, that is diagnosis and treatment of syphilis in pregnant women. So for antiretroviral treatment for pregnant women, the coverage in Cuba was more than 86% over the last 3 years. And of 100% of all of the children born of those cases, and the country also has to have prenatal coverage of more than one visit, and or that is equal to 95% of the cases. There was a 90% testing rate in Cuba for HIV, and before 23 weeks for syphilis, the rate was over 99% testing for syphilis. And treatment for syphilis was nearly 100% of all of the pregnant women. And so all of this data was checked, not only in the report, but in our on-site visit. And we even looked at the medical records in the clinics.
Thank you very much, Dr. Van Sanken. If there is no more questions here, then we would like to thank you everybody for being here today. For those who are following us online, if you want to hear more about how Cuba achieved the elimination, the process of validation, and what to expect in the region and in the world, you can stay here and we will come back in, let's say, 10 to 15 minutes for a panel of experts, a technical panel, right? No, we can do it right away. Okay, you can stay with us. We're going to have a panel of experts that will be discussing in detail this big achievement. Thank you again, everybody, and have a great day.